Hey YouTube fam, welcome to my YouTube channel and thanks for clicking on this video. In today's video lecture, we are going to understand a very important topic and the name of the topic is drugs acting on autonomic nervous system. Now in this title, we can see two main words जिसका के meaning समझना हमारे लिए बहुत ज़रूरी है. The very first word is known as a drug and the second one is known as autonomic nervous system. Now, if you can recall from previous video lecture that was on introduction to pharmacology, हमने उस वीडियो में ड्रग को कुछ इस तरह से डिफाइन किया था कि ड्रग्स आर नथिंग बट दे आर केमिकल एंटिटी which can be used for treatment purposes, prevention purposes and diagnostic purposes of a particular disease condition. Now, before moving to the problem of autonomic nervous system, let's consider an example. Let's suppose आपके friend को आपको message करना है. Now in today's world of social media, जो mainly हम apps use करते हैं, that is WhatsApp and Instagram. So आप जिस friend को message भेजना चाहते हो, you send the message. वो friend वो message को receive करेगा and accordingly he will give a reply. Now think over it. अगर मेरे बॉडी को अपने ऑर्गन्स के लिए मैसेज देना है, सेल्स को मैसेज देना है या फिर टिश्यूज को मैसेज देना है, हाउ विल आवर बॉडी सेंड दोज मैसेजेस? Definitely our body is not having WhatsApp or Instagram installed in it. Our body has two important systems. The very first system is known as hormonal system and the second one is known as nervous system. इस वीडियो में हम हार्मोन्स की बात नहीं करने वाले हैं एंड ये जो हार्मोन वाला पार्ट है वी विल बी कवरिंग इट इन सब्सिक्वेंट हार्मोन वाला वीडियो. नाउ इन टुडेज वीडियो लेक्चर आवर फोकस विल बी ऑन नर्वस सिस्टम. सो फॉर आवर सिंप्लिसिटी वी हैव कैटेगराइज्ड द नर्वस सिस्टम इनटू टू मेन डिवीजन. द वेरी फर्स्ट इज नोन एज central nervous system, which is comprising of brain and spinal cord. The second division is known as peripheral nervous system. This peripheral nervous system is again subclassified into two main groups. The very first one is known as autonomic nervous system and the second one is known as somatic nervous system. Further, this autonomic nervous system is divided into sympathetic nervous system and parasympathetic nervous system. Now, यहाँ पे sympathetic nervous system and parasympathetic nervous system को समझना बहुत ज़रूरी है. Let's suppose आप एक जंगल में जाते हो and आपके पीछे एक लायन पड़ जाता है. Now, in that particular condition, you need to run in order to save your life and our body feels that it is a threat. So, in this particular threatful situation, our body activates sympathetic nervous system. Now, कब हमारी body sympathetic nervous system को activate करती है? So, the answer is in 3F situation. The very first F situation is fight situation. जब भी हमारे को कभी भी झगड़ा करना है या फिर फाइट करना है एक पर्टिकुलर सिचुएशन से, our body activates sympathetic nervous system and our body feels that it is a threat. Second F situation is known as flight situation, जहां पर हमें एक सिचुएशन से भागना है, जैसे कुत्ता हमारे पीछे पड़ गया, लायन पीछे पड़ गया. So in that situation again our body activates sympathetic nervous system. And the last F situation is known as frightful situation. जब हमें डर लगता है, in that situation once again our body will activate sympathetic nervous system. The exact opposite is with parasympathetic nervous system. जब भी हमारी बॉडी एक रिलैक्स्ड कंडीशन में रहती है, जैसे कल कोई एग्जाम नहीं है, फैमिली की सारी प्रॉब्लम सॉर्टेड है, लाइफ में कोई टेंशन नहीं है, सब कुछ स्मूथली चल रहा है, in that particular scenario, the system that is dominating our human body is parasympathetic nervous system. Now, we need to understand what is the difference between autonomic nervous system and somatic nervous system. So this autonomic nervous system, यहाँ पे जो word है autonomic, this auto word means self and nomic का मतलब होता है governing. So this particular system is self-governing. That means we cannot control this system, and the word that is used here is involuntary control. That means हम ये system को control नहीं कर सकते हैं. Opposite to that, if we talk about somatic nervous system, this somatic nervous system is under our control and different skeletal muscle की movements हम खुद control कर सकते हैं. Now, in autonomic nervous system, the autonomic fiber is made up of two neurons which are connected in series. So, as you can see in this figure, this is our neuron number 1 and this is our neuron number 2 and here is our ganglia. Now, हम biologists को है ना चीज़ों को difficult करना बहुत अच्छा लगता है. So, this is not known as neuron number 1 or neuron number 2. This particular neuron is present before the ganglia and hence the name of this neuron is pre-ganglionic fiber. Now, this particular neuron number 2 is present after the ganglia and hence it is known as post-ganglionic fiber. Now, post-ganglionic fiber say there will be some release of neurotransmitters. Now, what do we mean by neurotransmitters? Let's come back to the texting वाला example. हम किसी को जब text करते हैं, we mainly use some kind of alphabets and that alphabets में हम words बनाते हैं. Similarly, inside our human body, in order to communicate, in order to create a response, our body or we can say our nerve ending releases certain chemicals and those chemicals, they are known as neurotransmitters. And this particular neurotransmitter will be acting on the effector cell. Now यहाँ पे effector cell का क्या मतलब होता है? जहाँ पर भी neurotransmitter अपना effect दिखाएंगे, that is known as effector cell or we can say target organ or tissue. This particular site जहाँ पे ये gap दिख रहा है, that is known as neuroeffector junction. If we talk about somatic nervous system, this somatic nervous system is mainly made up of single motor neuron which connects central nervous system to skeletal muscle. So as you can see, here is our motor nerve and here you can see there is a gap and this gap is known as neuromuscular junction and यहाँ से भी neurotransmitters release होंगे and that will show its effect on skeletal muscle. Now let us take a look on parasympathetic nervous system and sympathetic nervous system. Now in the parasympathetic nervous system, I want you to take a look on pre-ganglionic fiber and I want to take a look in the sympathetic nervous system of this particular neuron and that is pre-ganglionic fiber. Now here we can see that parasympathetic nervous system में जो pre-ganglionic fiber होते हैं they are longer in length and sympathetic nervous system के जो pre-ganglionic fibers होते हैं they are shorter in length. Now let us take a look in the post-ganglionic fiber of parasympathetic nervous system. So here we can see that the post-ganglionic fiber of parasympathetic nervous system are shorter in length and of that of sympathetic nervous system they are longer in length. Now here the pre-ganglionic fiber of sympathetic nervous system and parasympathetic nervous system they all are releasing acetylcholine as their main neurotransmitter. So in short here we need to understand one golden rule कि जितने भी pre-ganglionic fibers होते हैं whether they are of parasympathetic nervous system or they are of sympathetic nervous system they all are acetylcholine releasing neurotransmitter. And very importantly, this all nerve which releases acetylcholine as its main neurotransmitter, they are known as cholinergic in nature or we can say cholinergic neuron. Now in the post-ganglionic fiber of parasympathetic nervous system, the main neurotransmitter is acetylcholine. In sympathetic nervous system, the post-ganglionic fiber is releasing norepinephrine as its main neurotransmitter. But जब हम लोग 12th में chemistry पढ़ते थे, we had various different kinds of exception. So here also we have one such exception कि जो sympathetic nervous system का post-ganglionic fiber है, which is supplying to the sweat gland, that is releasing acetylcholine as its main neurotransmitter. Now, in the adrenal medulla, there will be stimulation of this particular medullary cells with the help of acetylcholine, and with this acetylcholine stimulation, this adrenal medulla will release adrenaline directly into our bloodstream. Here is our motor nerve, and this motor nerve is also cholinergic in nature, and that will release acetylcholine. Now, इतना सब कुछ हमने पढ़ लिया. Now we must understand from where this sympathetic autonomic nerves are basically arising and parasympathetic nerves कहाँ से arise होते हैं. So for the parasympathetic nervous system, there are two main outflow. The very first outflow is cranial outflow, and the second outflow is known as sacral outflow. Now cranial outflow में we have different cranial nerves. So ऐसी कितनी cranial nerves होती है? So the answer is there are 12 cranial nerves. उसमें से the cranial number 3, cranial number 7, cranial number 9 and 10, they are parasympathetic in nature. And जो sacral outflow है, that is starting from S2 से लेके S4, they are parasympathetic outflow. Now, when we talk about the sympathetic nervous system का जो outflow होता है, that is taking place from the spinal cord, and spinal cord में कहाँ पे? It is taking place from thoracolumbar outflow. So that's it for this video. If you find this particular video interesting and if it has added value to your knowledge, please like, share and subscribe to our YouTube channel. In the next video, we will understand कि जो norepinephrine है, how this norepinephrine is getting synthesized, how it is getting stored and how it is getting released from the nerve ending, and we will also see what are the important drugs which are acting on that particular system. Till the next video, see ya, bye bye, have a good day.